So I wanted to talk about spondylolysis, which is a stress fracture of the pars interarticularis caused by repetitive extension and rotation of the spine. Again, we're not made to do backflips. It doesn't help us to hunt and to harvest small fruits. So it's an extreme stress on the body. These patients are going to complain of pain with extension, and they can also have a decreased hamstring flexibility. I recommend to do an X-ray for them just because you want to make sure that there's no spondylolisthesis that we'll talk in the next slide. The only thing is that I recommend only AP and lateral X-ray. I don't recommend the obliques because it's a lot of radiation. There are two ovaries and a uterus in the way, and it's not going to give you more info because if it looks like spondy, it's spondy. Don't question, don't bug your mind too much about it. If it looks like spondy, it's spondy. If you have point tenderness on one side, if it's sore, if the athlete is involved in extension, it's spondy. Treat it like spondy and it's going to get better. So I don't recommend CT, MRI, or bone scan. And treatment is with rest, core strengthening, lower extremity stretching, bracing as needed, but I've never had to go there. The reason I do the X-ray is to rule out spondylolisthesis, which is an anterior translation of a vertebral body over another, which happens when spondylolysis is improperly managed. So basically you have two spondies at the same level, and it can create movement over one vertebral body over the other. It's usually graded from 1 to 4 according to the percentage of translation, from 25 to 50 to 75 to 100. It can be traumatic. Sometime after a dramatic fall, you can do an X-ray and you see that. It's very concerning because you don't know if it's stable or not. So I would recommend talking to a pediatric orthopedist if you see that. And treatment will be depending on the grade. Grade 1 and grade 2 will usually be treated as a spondy, while grade 3 and grade 4 will likely be treated surgically. As you can see over here, you have a grade 4 spondylolisthesis, which completely compresses the nerves coming down from the brain. That had to be treated with screws and plates and fixation, which tend to refrain the patient from either bending forward or backward. So no more gymnastics and tying your shoes. I usually tend to X-ray them every 6 to 9 months, maybe every 9 to 12 months until full skeletal maturity, because you want to make sure that this spondylolisthesis is not going to move, it's not going to keep progressing, and you're not going to fall into the surgical aspect of treatment. So I usually recommend that you need to X-ray them every once in a while until they're fully grown.